Sometimes the most transformative ideas, the real breakthroughs, they come from places you just don't expect, like, say, from a 14-year-old.
It's pretty incredible when that happens.
Absolutely. And that's what we're diving deep into today. The story of Siddharth Nandyala and his AI application, CircadiaV.
CircadiaV, yeah.
Get this. It's an app that can apparently detect heart disease in just 7 seconds. 7.
And with really high reported accuracy, too, over 96%.
Which is just astounding.
It really is. And you have to remember the context here. Cardiovascular diseases, they're the #1 cause of death globally. We're talking about roughly a third of all deaths. It's a massive, massive problem.
A huge challenge. So when you hear about an innovation like this, especially from someone so young, it's not just impressive. It feels like it could be truly significant.
Exactly. It's tackling one of our biggest health crises head on.
So that's our mission for this deep dive. We're going to unpack the tech behind CircadiaV, really look at its potential to maybe revolutionize global health.
And definitely explore the journey of Siddharth himself. It's quite the story.
It really is. Okay, let's unpack this a bit. To really get why CircadiaV matters, we need to understand the situation it's trying to address.
The global health challenge.
Right. We know heart disease is devastating, but it's particularly tough in underserved regions. Think about, developing countries, rural communities.
Places where access to even basic diagnostic tools is really scarce.
Exactly. Equipment like ECGs, electrocardiograms, and the specialists needed to read them, often just not available, or miles and miles away.
That lack of access, that delay in diagnosis, it directly contributes to higher mortality rates. People often don't find out there's a problem until it's far too late.
Which creates this clear, urgent need for something different, something faster, cheaper, more accessible.
Definitely. A way to get quick diagnostic insights, especially in those low-resource settings.
And that's precisely where CircadiaV aims to fit in. It's built around smartphone technology, something that's becoming pretty ubiquitous, even in remote areas.
Making advanced diagnostics potentially much more reachable.
So, the core idea. An AI app that identifies heart conditions fast. We mentioned the speed 7 seconds and that reported accuracy over 96%.
Which is remarkable when you compare that to the weeks, sometimes months, it can take for conventional diagnostics, especially involving specialists.
It's a world of difference. Now, it's important to stress its current purpose. It's designed as a pre-diagnostic tool.
Right, for clinical use, for doctors, nurses, health workers.
Yeah, to complement traditional methods, not necessarily replace them outright, at least not yet.
But even in that role, it represents the big step towards, democratizing healthcare, breaking down those barriers of cost and specialized equipment.
It really could empower frontline health workers, couldn't it?
Absolutely, giving them a powerful tool right in their pocket.
Okay, here's where it gets really interesting. How does it actually work?
The mechanics of it.
Yeah, it boils down to 3 pretty straightforward steps. First, recording.
Simple enough.
You just hold your smartphone near your chest. The app records heart sounds for only 7 seconds. That's it.
Just 7 seconds of sound.
Then step 2, processing. This is where the AI comes in. The app uses a machine learning algorithm.
Deep learning models, specifically.
Right. To analyze that sound data, it filters out background noise, which is crucial.
Very important for accuracy in real-world settings.
And then it compares the patterns to a model trained on literally thousands of anonymous heart profiles, phonocardiograms, PCG recordings.
So it's learned what different heart conditions sound like.
Exactly, which leads to step 3, diagnosis, or maybe better put, preliminary identification.
A pre-diagnostic report, yeah.
Within seconds, it flags potential issues. Arrhythmias, heart failure signs, coronary disease indicators, valvular problems, things like that.
Generating that initial report for the medical professional.
And they mentioned it's been tested pretty extensively already, right? On thousands of patients?
Yeah, reports say testing happened in both the US and India, which gives it some diverse data points.
Okay, so that's the tech. But the story behind the tech is just as compelling. Let's talk about Siddharth Nandyala.
The innovator himself.
He's 14, based in Frisco, Texas, but originally from Anantapur in India, moved over in 2010.
And his journey into tech started incredibly early.
Didn't it just? He started programming at age 7. 7.
Wow.
I mean, seriously. And it's not just CircadiaV. He's also the CEO of an initiative called STEM IT.
Promoting science and tech education globally.
And as if that wasn't enough, he's also working on a brain-controlled prosthetic arm.
Another huge undertaking.
Yeah, and aiming to make it significantly cheaper than current options. It's just remarkable drive and vision for someone so young.
It really makes you think, doesn't it, about the power of youth innovation. Siddharth's work is such a potent example.
Truly inspirational, shows what's possible when you combine passion, skill, and a drive to solve big problems.
It really sets a standard and hopefully inspires others, the next generation of innovators.
So what does this all mean? Let's talk potential impact.
The bigger picture.
CircadiaV could genuinely revolutionize early heart disease detection, especially, as we said, in those underserved communities.
Where the need is greatest.
Imagine bypassing the need for expensive ECG machines in remote clinics. It could really democratize diagnostics.
Potentially easing the burden on healthcare systems, too, by catching problems earlier when they're easier and cheaper to treat.
And ultimately, saving lives. In countries with high rates of cardiovascular disease, faster, accessible screening like this could be transformative. Timely interventions become possible.
It feels like a really tangible step towards more inclusive, more equitable healthcare around the world, putting powerful tools where they're needed most.
Okay, but let's be realistic too. It sounds amazing, but getting a new medical technology like this into widespread use, it's never simple. There are hurdles.
Always. Especially in healthcare.
Right. So what are the main challenges CircadiaV faces? First off, clinical validation.
Absolutely critical. That 96% accuracy figure is impressive, but it needs more extensive testing.
Across diverse populations, different settings, real-world conditions, to really nail down its reliability.
Confirm it consistently performs as expected.
Then there's regulations. Medical devices face incredibly strict approval processes, FDA, EMA, other bodies.
And that takes time. A lot of time, usually, and significant resources for trials and documentation. It can be a major bottleneck.
Definitely. Third, data privacy. We're talking sensitive health information here.
Paramount. You need robust security, absolute confidentiality. Patients and doctors need to trust the platform completely.
Fourth is scalability. Moving beyond controlled clinical trials to widespread use, maybe even outside traditional clinics eventually, that brings challenges.
User interface design, training people to use it correctly, ensuring consistency.
Exactly. And finally, probably linked to validation is medical acceptance.
Gaining the trust of the medical community.
Yeah. Doctors and health systems need to be convinced of its accuracy and its value. That means transparency. Sharing the data, publishing rigorous studies.
Overcoming all these hurdles isn't just a technical problem, is it? It's about responsible integration.
Right. Ensuring these powerful AI tools are brought into healthcare safely, effectively, and ethically.
Building that trust, proving the value proposition beyond doubt.
So, quite a journey ahead for CircadiaV, despite the incredible start.
Definitely.
But what a story. CircadiaV, Siddharth Nandyala. It's a powerful glimpse into how AI and sheer ingenuity, even from unexpected places, can tackle massive global health issues.
It truly is, and it brings up a really interesting, broader question for all of us, doesn't it? Well, how do we as a society manage this incredibly fast pace of tech innovation, especially from brilliant young minds like Siddharth's? How do we balance supporting that incredible drive with the absolute necessity for rigorous medical validation and ethical oversight?
That's a deep question.
What's our role in nurturing these innovators while making sure their creations are deployed safely, equitably, and effectively for everyone's benefit?
Something definitely worth pondering. We encourage you to think about that and maybe do your own deep dive into this fascinating space where technology, health, and human potential all intersect.